Coming up on Medwatch today, a look at the fertility procedure that's helped thousands of couples become a family. What's driving a sudden increase in ER visits thanks to a change in California law, and a closer look at what doctors can do for certain cases of stomach pain. Hi there, and thanks for joining us. I'm Julie Musgrave. For many couples, having children is a dream come true. So you can imagine the heartbreak when pregnancy doesn't come naturally. But thanks to a certain advanced fertility treatment, thousands of babies have been born from love with a little help from science.
We got married in our late 20s and thought, that babies would come immediately.
Kimberly Cox and her husband wanted a family. But time went by and they struggled to conceive.
After a couple years of not getting pregnant, it was kind of like, what's going on? And we just had a little bit of unexplained infertility was our diagnosis.
Frustrated, the couple looked at their options. They found hope in 3 letters.
IVF stands for in vitro fertilization. It is an advanced reproductive technology to help women get pregnant.
Dr. Michael Shin is the program director at the Women's Specialty and Fertility Center on the Clovis Community Campus. He says maximum fertility age is around 25 or 26. Fertile couples in that range have a 20% chance of getting pregnant. For couples having trouble, the chance drops to just 4%.
IVF gives most couples a 40% chance, twice Mother Nature's numbers.
The process itself is relatively quick.
Women take fertility medications and grow a bunch of follicles or eggs. Once a number of follicles have grown, we get the eggs out of the patient. We get sperm from dad, mix them together to make embryos, and about 3 to 5 days later, place an embryo into the uterus to help patients get pregnant.
Dr. Shin says if successful, pregnancy can happen within 2 weeks. Still, it's not a guarantee, nor is it easy.
It's an emotional roller coaster. I won't say that we were always positive or always hopeful, but that was what we tried to focus on. It's hard because when you're putting so much time and effort and money into something like that, you expect to get it in return, right? You get what you pay for.
Kimberly says it took patience and ongoing support from the medical team.
This is not the end of the road. Infertility may be your diagnosis, but that's not the end result. We're gonna do our best to get you pregnant and give you your miracle.
And they did, twice.
I have a 2.5-year-old girl, Macy, who is awesome. She's crazy and into everything.
Little sister Paisley joined the fun just a few months ago. A happy family of 4 that Kimberly once worried wouldn't be possible.
Every poke, every dollar spent, like when they put that miracle in your arms, it's all so worth it.
Emergency room visits are up, and doctors say there is a link between new marijuana legislation in California and the symptoms many patients are experiencing. Dr. Race Vora explains. Right now, we are seeing an increase in emergency room visits. So, doctor, we want to talk to you about why exactly we're seeing that. You guys are kind of linking it back to one particular thing. What is that?
Yeah, you're basically hearing a lot of news stories about people that are increasingly exposed to marijuana, especially in this era of increased availability and the deregulation that we've recently experienced. More and more people in our community are experimenting with this substance and using it perhaps on a more frequent basis than they were before. And we're seeing several different types of emergency department visits related to it. In the adults, what we tend to see is people that may be using it chronically or are using it on a habitual basis, and they end up having something that we call the hyperemesis syndrome. Sometimes it's known as the cannabis hyperemesis syndrome. and that's characterized by it's an unusual picture in that they just have a lot of vomiting and nausea, and it can be lasting days to weeks, and the only thing that seems to relieve it, for some weird reason that we're still trying to figure out the science behind, is that they have to take very hot showers. The strains that people may be using are more potent than they have been in the past. They're probably using them at a frequency that's greater than they have before. And there may be patient factors where the more people in a population are exposed to it, the more we are able to discover some of these complications that were very rare before, but are now coming to the fore and becoming more common now.
What are some of the main symptoms that you guys are looking for to attribute?
Typically severe vomiting, dehydration, abdominal pain, diarrhea sometimes occurs. People just are not very happy.
Why do you think there's such an uptick in that?
Well, that's a great question. Certainly, we're seeing more people in the community using this substance, either recreationally or for medicinal purposes. And we're also seeing that there's different strains that are being developed, and they're more potent than what we've seen in the past. And I think the combination of those factors is leading some patients to have this complication.
And it's interesting to note, too, that it's not just smoking marijuana. There's other ways.
That's correct. Smoking is just one way that people are able to get access to the marijuana. There's also edible products that they can use. They can actually get access to butter or oil and then use that in their cooking, or just get edible products ready-made that contain the THC and other oils that would contain the marijuana substance. There's even creams and lotions that people are starting to use for neuropathic pain and other types of pain symptoms.
So what do you think the solution is? How do we fix this problem?
Great question. The science is still not quite worked out, so we're still learning more and more about exactly what's going on in a person's body by the time they get this syndrome. And once we establish the diagnosis that this is the hyperemesis syndrome related to cannabis, then we can start to retreat the patient with rehydrating them with either IV fluids, or if they can drink fluids after we give them some nausea medicine, we can try to give them some nausea medicine. What we do know is that once people stop smoking or ingesting the marijuana, that this syndrome seems to kind of cure itself. So what we tell people is, if you could just stop the exposure, that this syndrome will take care of itself sooner or later. And in the meantime, we'll try to do other medications and see what works.
Okay, certainly need to be careful.
That's right.
Doctor, thank you so much. We appreciate your time.
Coming up on Medwatch today, is your morning cup of coffee exposing you to chemicals? The lawsuit that's trying to get a warning on Java. And a state award honoring this week's healthcare hero for her work helping patients through traumatic brain injury.